Let's take you inside some of the medical response to all of this. Ciro Panessa is the president and CEO of Northern Health, which services Tumbler Ridge. Ciro, thank you very much for your time this morning.
No problem, David.
I wonder if you can take us into that moment as the shooting unfolds. How many people were working inside the ER at the time of that incident?
Yeah, well, there'd normally be a nurse and physician covering the ER. There was another physician that would be in the health center covering primary care area, as well as some other nurses, diagnostic imaging technologists who would be supporting the primary care, as also the ER side.
And how did that small number of staff manage and respond to this as it became clear what had happened?
Yeah, I mean, they just did a tremendous job under a really extraordinary and difficult situation. I just can't thank them enough. I'm going to be meeting with them again this morning to connect with them and express that thanks. Thanks personally. It was, and they did a tremendous job, in particular, stabilizing two very seriously injured individuals who have subsequently, were stabilized for transport to higher level of care. And, I just have to say in a small town, in a small community, being a healthcare professional, you often do know and love the people that you're caring for. So, a tremendously difficult situation. For us right now, our as an organization, me personally, our hearts are with the whole community, with the family and friends, but then in particular, now with the healthcare staff and supporting them through this as they're also trying to continue their work and their role in the community.
Was that the case on Tuesday? Did the staff members know some of those they were treating?
Yeah, I'm not going to get into that level of detail into specifics, but generally, that just it's impossible for that to not be the case when you're looking at a community that is the size of Tumbler Ridge, but. They just did an outstanding job, and how quickly everything unfolded. We're tremendously grateful to BC Emergency Health Services, to the RCMP, to the fire department. Just how quickly ground resources, fixed wing, rotary wing assets. Even getting support very quickly from Alberta to potentially be available. That support so that the team was able to focus on working with the paramedics to stabilize those that were most critically ill and move them to a higher level of care. And for that to happen as expeditiously as possible. I mean, that given the horror of it all, I mean, that really was the best that could be done, and saw the best of people and saw the best of how everyone was able to mobilize really quickly on that first response.
Did that response, in your mind, save lives on Tuesday afternoon?
Well, let's absolutely. And, then, we've got two critically injured individuals now that, our thoughts and prayers are that everyone that was injured and those most seriously ill now are going to be able to recover and like the whole community now, it's going to be a long, complex, and very individual journey for everyone, and a journey for the whole community about returning to some kind of new normal.
Ciro, I know you were at the vigil last night. There are a lot of resources. Northern Health is behind some of those resources being brought in to help families now. What does that look like?
Yeah, we're focused on our end trying to mobilize counseling support, mental health clinician support to have that be available on a drop-in basis when people need it at the health center. We're looking to have the hours right now as much as possible from essentially be from around 7, 8 in the morning through to about 10 to 11 at night. And we're looking to keep that going for we haven't set an end date to that at this point. We are also working closely with a number of partners, the school district, Ministry of Children and Family Development, First Nations Health Authority, other health authorities, Ministry of Health, Ministry of Education, to support additional specific in-person counseling for youth, for the school community, parents specifically. So really trying to have specific in-person resources for the children and those that are connected to the school, but then also have in-person resources supports for the community more broadly. And looking to have, like I said, have that be available when people need it for as many hours, get coverage for as many hours a day as we can, and then we'll keep assessing and connecting and working closely with the district and all the partners to see if we've got it got what's needed in place, and if not, keep adjusting and work closely with the community around how long we need to have different types of services here in place to support everyone right now as they're coming together and supporting each other during this tragedy.
Ciro, thank you very much.
Yeah, no, appreciate it, David. We'll just the other thing, other focus for us is the team, and we are bringing in extra staff to provide rest, relief, reprieve for the local team. And as an organization, there's lots of people across the north that have connections to Tumbler Ridge personally. And so, putting supports in place for staff who need it across the whole organization and in Tumbler Ridge and more locally here in the South Piece. But yeah, we appreciate you taking the time to connect and set our hearts and we're with Tumbler Ridge here, and we'll keep doing our best to mobilize supports for the community.
And we're thinking of you as well. Ciro, thank you.
Thank you.